One of the most common questions I get from patients coming to see me, because I specialize in minimally invasive spine surgery, is they want to know about laser spine surgery. And this is, in many ways, I suppose, good and bad for my field, because it's sort of making us, at least me personally, to try to find legitimate technologies to help people have real minimally invasive spine surgeries. Unfortunately, the term laser is very misleading, and some of our less scrupulous colleagues have used this to try to, it's more really for a marketing purpose, because what ends up happening is people are drawn to this phrase because it sounds very high-tech, and even fellow doctors, physicians who are not who are not spine experts, can be fooled by this, because laser is a legitimate medical tool in other types of surgeries, but not in spine. There's really very few roles for lasers in spine surgery. Occasionally we'll use it in certain pediatric cases, but for a lot of the routine adult cases, it has no role. And so it's a term that's used to bring people in, and either I think what happens based on what I've seen and what I've heard is that they are offered the routine surgeries or the accepted surgeries to the patients, but then if the patients are really set on having laser, then a laser is used in some sort of procedure, but really it doesn't do a whole lot except may perhaps create a placebo effect. And the other thing that is really troublesome is what I often hear from these patients is that when they go to some of these institutions where they offer laser spine surgery, it's a bit of a financial issue for them because, without exception, most of these places don't take insurance. And so it's a cash burden on the patients, because the patients want to believe that this is something that's better because it's not covered by insurance, and that's just not the case. And so, in my mind, I feel for these patients who are taken in by the search for what they think is better, and it'll cost them money that sometimes can't afford, and they end up having to come and see people like me for the real operation.